Well, we really think that when we talk about the VXVY solution and our approach, there's really three main areas that we focus on. The first one is promoting effective investment. If investors, the venture capitalists and other investors are not investing in the right things, then that means more junk coming to market. Going back to the 20,000 apps, there's some great stuff in there, but there's an awful lot of junk because people have invested in the wrong things. So we want to help those investors understand some of the best things, help them de-risk their portfolios so that they're putting money into companies that are more likely to build effective products and more likely to survive long term. The second is to build a network. I mentioned the Tech Innovation Network, and we've reconstructed that under VXVY, and it's a collection of tech companies, health systems, the end users, investors. So it's really the same thing that we had with the TIN, but greatly expanded so that everybody, every kind of organization that's in any way touched by mental health and mental illness can be part of the process of helping to bring great digital mental health to the marketplace. And then the last area is that we want to make sure that the stuff that does make it to market is really high quality, that it's safe, that it's effective, that it's been thoroughly researched, and that it's widely used. These products aren't going to be able to help us address the big, larger systems issues that I was mentioning earlier unless they're really great products and unless lots of people are using them. Just having a handful of users isn't going to make a dent in the problems that we have. So I talked about the network, and this is just a diagram of that. We think there's kind of four big buckets for our network. Investors, who are, again, driving everything because they're the source of funding to develop these products and help them get out into the marketplace. Healthcare systems, they serve lots of people, and so it's a great place to make a huge impact. The same thing with employers. If we can, get a company like Coca-Cola to have a big rollout of tech solutions, for their workforce, then we can have a massive impact by just working with one individual company. The community partners, then that's, again, everything from schools, clinical providers, both individual or group practices, hospitals, emergency responders, every kind of organization that you can think of. And then the tech innovators, which are the people who are designing the digital therapeutics, whether it's a large tech company or some of the smaller startups that we work with. So we have a membership model, and that's the network I was talking about. And we're happy to announce today for the first time that we've made the decision to now make membership free because we realized that cost was sometimes an obstacle for people to be able to join our network and participate. And we're only going to have the kind of industry-wide impact that we want to have if we can bring lots of people into it. So for free, any organization can join us, and they can, you see this list. I won't read down all the bullet points, but they can, we help facilitate connections with other network members so they can learn from one another. We help them with their business and some of the, the business development things, help them get exposure and promotion for their company and for their products to be able to sell more and get more things into the hands of users. And then educational opportunities. So things like this seminar that we're going to do on an ongoing basis. And then in addition to that, we have a number of services, and this is really our bread and butter that we offer in addition for additional fees to organizations where we can help them de-risk their technology, help improve employment, help investors and employers be able to look at different products and figure out what's the best one to go with. As I mentioned, helping people implement and design the implementation process, looking at the market for various products and helping people understand where their product might fit. There's organizations that we worked with that said, oh, we want to have this product that's designed for use in mental health treatment, and we said, well, actually that might have application in addictions or in schools. Let's try it out in those environments and see how it works. Oftentimes, this goes back to helping people make the diligence and investment support, but oftentimes there's not just one solution for an organization. A lot of companies might say, oh, we're going to give all of our employees access to Headspace and then call it a day and say that we checked the mental health box. But it's not so simple. There's not one size fits all with these products. And so oftentimes it's having several things bundled together to be able to get the outcomes that you want. Conducting clinical trials, working on some of the things I mentioned earlier, like reimbursement and regulatory, and then helping them develop content for their products and make overall improvements. So we have, been working at this for 7 years. This is just a few of our partners that we were really excited to have them, give us great feedback. We think that we've had a lot of successes with companies, like Trip, Limbix Health. Limbix is a company that has an app that facilitates doing cognitive behavioral therapy for adolescents. And Tom Insel, who used to direct the National Institutes of Mental Health, and he's now a tech entrepreneur. He was the mental health czar for California, and we've worked with Tom on several different projects, and he's a big fan of the organization. So we really feel that this approach is validated, that for what we're trying to do with VXVY. I probably should have put this slide up front because these are the people that really make it all happen. And there's two of our folks that are not on here, Zach and Rocky. If you're on here, apologies that I don't have your pictures yet. They're helping us with tech vetting. But our staff is small but mighty. And so, with this group of people, we have experts in psychology, psychiatry, project management, public health, business development, and even things, if you need a juggler or a volleyball player or a rugby player, we have all of that with this really amazing staff that we have. And, together collectively, this whole group came, together from the university. All of us left and all of us stayed with VXVY. And we've been at this work both together and then independently before that for decades. And so we really have a lot of expertise in the mental health space. And we were the first organization of our kind when we started at CU. So together, we really think that we can do this. Our goal is not just to help individual organizations or companies. That's our strategy. But our ultimate goal is that we want to change an entire industry. We want to influence the digital mental health industry and elevate the quality of the products, get them in the hands of the people that need them most, make sure that people who are underserved have access to all of these products. And we can, in the process, we can transform millions and millions of lives. And at the end of the day, we are and always will be a mission-driven organization, and we're here because we want to help people. And we think that this is the best approach that we can take to do that. So we want people to join us. If you're an organization watching today that's not a member, please join us. Go to our website, VXVYmentalhealth.com, and you can find more information about our memberships and apply and become one. And like I said, if you have any questions about the talk today or things that came up that you just didn't understand because I was talking too fast, please email us at info@VXVYmentalhealth.com. So with that, I'll thank you for joining the webinar today. And when you become a member, you'll get notices about our future educational seminars and series. And we have some really, really great stuff that's already lined up for that. So hope people join us. And thanks again for your time today.